Horoscopic Caesarean section. Have you ever heard of horoscopic Caesarean section? This is when parents request a Caesarean section to be done at a specific date and time based on astrology or religious belief. In Malaysia, this is quite common, especially among Chinese and Indian communities. Some believe that the success and fortune of a child are influenced by the exact moment they are born. So they consult astrologers or religious leaders to pick the perfect date and time for delivery. I have been in practice for 31 years and I do get these requests often. However, there are some important things I always discuss with my patients. Timing matters. First, a cesarean section should be ideally done after 38 weeks of pregnancy. Some parents want it earlier at 36 or 37 weeks, but that is risky. A baby born too early may face complications due to prematurity, so I always insist on waiting until at least 38 weeks. Doctor's availability. Next, the date and time they choose must fit into my schedule. Sometimes they pick a date and time when I'm already in surgery or even when I'm on leave. If this happens, I may have to ask a colleague to do the procedure instead. Late night surgeries are risky. One of the biggest challenges is when parents request a cesarean section at odd hours, like after midnight. This is not ideal because both the surgical team and the anesthetist may be exhausted, which increase the risks of error. Emergencies are also harder to manage at that time, and hospital charges are usually higher for surgeries done outside office hours. Exact timing is unpredictable. Another issue is that astrologers or religious leaders usually give a 2-hour grace period within which the baby should be delivered. However, some parents want their baby to be born at the exact time, down to the minute. This is something I never promise because it's almost impossible to control. There can be delays in getting an operating room, administering spinal anesthesia, or even reaching the baby during the surgery itself. That's why I always insist that parents allow me a 2-hour window to safely deliver their baby. Finding the balance. That said, private practice is all about accommodating patients, and I always try my best to meet their needs. Over the years, I've performed many horoscopic Caesarean sections based on their special request. Most of the time, parents consult a priest or a medium who selects a specific date and time for the surgery. At the end of the day, my priority is the safety of both the mother and the baby. If we can find a timing that works medically and logistically, I am happy to help.